Hey.
Welcome to Lesson 4 on this team course for dental occlusion, specifically on the temporomandibular joint. And on this lesson, we're going to specifically talk about the evaluation of the temporomandibular joint, so you, the team, can have a better understanding of what the dentist is looking at and be able to talk to the patient about it a little bit more also. So when we start the examination of the joint, where you will oftentimes see us feel the outside of the joint on both sides. And what we're doing is a few things. We're feeling the lateral pull for discomfort. We're also starting to feel for any of the clicking and popping that we talked about, and also listen for any of the clicking and popping. And although I'm not going to go into listening to the joint in this lesson, sometimes if we do feel or hear a click or a pop, that's the time we'll either get the stethoscope out so we can hear it real closely, or the Doppler so that we can actually hear it over a speaker with the patient. But I'm not going to go into that at all today. In fact, that's all we're going to talk about that today. But this is when we start to hear and feel for clicking and popping joints. And finally, this is a great time to start to observe the motion. So when we're asking the patient to open and close as we're feeling for tension, tenderness, or discomfort, I can also at the same time be watching how the jaw opens. And we're going to talk about range of opening in just a minute, but we can do a lot of things at the same time. In fact, I'm not the best multitasker, but this is one of the times that I can actually do a few things at one time. So that might be going on in your practice and you don't even know it. But keep in mind when we're doing this exam or starting the exam, we're really just feeling, again, that lateral pull, just the outside of each condyle. And so we're doing the best we can to guess what's going on inside by only feeling what we can feel from the lateral pull. While we're in the area, before we move on, the other thing we're looking at is for inflammation or tenderness in that retrodiscal area or behind the joint itself. So we'll actually have the patient open, sneak our fingers just behind the joint, and just apply a little pressure and see if there's any tension, tenderness, or discomfort, looking for any inflammation in that retrodiscal area. So let's go back to what we're talking about as we're watching the patient open and close. Because you might, in fact, you can look in the mirror and do this, or you can look with your team members, but oftentimes when we open and close, we don't open and close on this perfect straight line, and that tells us something. So ideally, we would love it when you look at this photo here, if you didn't see any lines on the left side or the right side. So again, when she opened, she just opened straight and closed straight. But what we find is that she deviated to one side and when she opened, and oftentimes I'll refer to it as an S-curve, because what she did is she started to the left and then came back to the midline, and then when she closed, she was in the midline, so she went back to the left and came back to the midline again, all based upon the maxillary midline, and we watch what happens to the mandible. So again, why do we do this? Well, if somebody's not opening straight, there's a reason for that, right? So is it the muscles that are not working in harmony? Is it that one joint is not coming, the ball is not coming out of the socket properly? Is there a disc caught? And so again, we're starting to see a lot of things come together in occlusion now, and this is a big part of trying to put the pieces of the puzzle together. I mentioned earlier for you to sort of keep your mind on that ligament that holds the disc in. And if that disc is constantly stretched out or has been overstretched, let's say because the disc is always forward of the ball or the condyle, we can test this by actually putting our finger or our pinky inside of the patient's ear and pressing forward, because remember, that's right where the ligament is, and we'll hear or feel a little click or pop back there. And that doesn't mean anything terrible is happening. It just means that there might be a correlation to what's going on with the disc because that ligament has been stretched out. So you'll see us talk about ligament laxity and hearing or feeling a little pop inside of the ear when the patient opens and closes. And again, your participation time, I would have you put your finger in your ear and open and close, and I'll bet somebody in your office probably has a little click or pop. And if they do, probably they're the one that's going to have everybody else's finger in their ear so everybody else can feel it. So I would have you do that because it's really cool to feel that, and the odds are somebody in your office does. The next part of the examination then that makes sense is range of motion. Is the jaw able to, is the temporomandibular joint able to open as well as it should, so whether it be somewhere between 30 and 50 millimeters, and can it move side to side without being stopped going either direction, and is about the same on either side. So we look at range of motion using a ruler that you can see here going side to side, and then another one, the same, just using a different way, that we can measure comfortable opening and maximum opening. And again, if any of these are not within normal limits, it tells us that something might be going on with one or both joints, or the muscles, of course, but it's usually joint related at this point. Finally, we're going to spend a couple minutes talking about this load test, what we call the load test. And when we talk about temporomandibular joints, I want you to start to think like an orthopedic physician or an orthopedic surgeon, right? It's a ball in a socket, and same as your shoulder or your hip, it needs to be able to move around or be loaded without pain, right? You wouldn't be able to stand on your right leg if the ball in the socket in your hip can't have some pressure put on it. And it's the same with the temporomandibular joint. So how do we test for that? Well, we actually test for it by using a leaf gauge or an anterior deprogrammer, which we're going to talk about a little bit more in a couple of minutes. But what we want to do is take the teeth completely out of play, and we want to use our squeezer muscles that we talked about in the muscle course, and they're just going to shove the ball right up into the socket. And when we shove the ball up into the socket, it should be pain-free, right? Because the ball is in the socket, and we'd like that piece of cartilage that doesn't have any nerve vessels or any nerve endings or blood vessels in it to be in between the ball and socket. And we should be able to just shove right up in there and have no pain or discomfort. So that's the load test. And if we do that and there's no pain or discomfort, that's pretty good. If there is some pain or discomfort, it tells us a couple things that we'll get into in a couple of minutes. But when you hear us talk about the load test, it's really taking the teeth out of play, shoving the ball into the socket by using the muscles that actually carry it there anyway, and seeing if there's any pain, discomfort, or tenderness. And as I mentioned earlier, if there is pain or discomfort, it is oftentimes caused by, again, the ball being shoved up into the socket without the disc there. And what's it shoving into, as we talked about? It's that retrodiscal tissue that has the blood vessels and nerve endings up in through there. So oftentimes, you can imagine, if you took a ball in a socket and you shoved it into something that had all these nerve endings, it's probably going to hurt. So those are the general components of the examination of the temporomandibular joint. And again, I hope you will go back to this lesson if you need to sort of refresh it. I went through it sort of quickly, but I wanted you to just have an appreciation for what each component is and maybe why we do it and what we're looking for. And the whole idea of doing this exam is really to identify the patients that are safe or predictable. Because when we start to see pain or discomfort in the temporomandibular joint, a lot of the predictability of dentistry goes away, and it can create some conflict in the office, and we want to avoid that as much as we can. So I hope that this lesson on the examination has been helpful, and I'll see you in the next lesson.